day, about 1,000 pregnant women lose their life either during, before, and after childbirth. Globally, about 600,000 women lose their lives every day as a result of complications from childbirth. Nigeria accounts for 10% of this staggering figure, making her the second highest in the world in mortality rates. This is the shocking fact. Welcome to Medical Insights.
All over the world, motherhood is a cherished experience. The joy that the birth of a child brings to the family can only be imagined than described. With the arrival of a new baby, the entire family goes agog. For the 9 months that the baby is being formed in the womb, the mother goes through a series of psychological, emotional, and physical changes. Changes that could affect the health of both mother and child. In this part of the world, death from childbirth or maternal and infant mortality is of a major concern. It is indeed such a major health issue that governments now commit a large part of their health budgets to its control. The World Health Organization, WHO, defines maternal mortality as the number of women per 100,000 who die from complications during pregnancy, childbirth, or within 42 days of the termination of pregnancy in a year. This is irrespective of the duration, the site of the pregnancy, and the cause of death, as long as it is not accidental or incidental. Every day, about 2,000 women die from pregnancy or childbirth-related complications. An estimated 360,000 maternal deaths are recorded every year worldwide. Most of the complications occur because of the poor health infrastructures available, while in some instances, the pregnancy would have aggravated an existing disease. The 4 major killers are severe bleeding, infections that occur soon after delivery, pregnancy-induced hypertension known as eclampsia, and obstructed labor. Deaths can also occur from malaria, anemia, HIV, or from poor health at conception and a lack of adequate care needed for the healthy outcome of the pregnancy for the mothers and their babies. In Nigeria, Lagos State is on the forefront of all the 36 states in the efforts at reducing maternal mortality ratio. Recently, the state government commissioned a 4-story 100-bed mother and child center in Surulere, Lagos. This is to strategically address the unacceptably high infant and maternal mortality indices in the state. According to the state governor, Mr. Babatunde Fashola, the Surulere Mother and Child Center is the 5th to be commissioned out of the 10 of such centers the government plans to establish in different parts of the state. The governor expressed satisfaction with the quality of work at the center and appealed to Lagosians to assist the government by paying their taxes.
On top of the range is that we are also here to hand over a 110-bed maternal and child care center with 2 surgical theaters and 7 consulting rooms sitting on 4 floors. All of this was built with your taxes. This is the evidence of what we can collectively do if we pull resources together.
Later in an interview, the Lagos State Commissioner for Health, Dr. Jide Idris emphasized that the Mother and Child Center, whose facilities are comparable to those in any standard hospital anywhere in the world, is also manned by well-trained and qualified medical and other support staff.
No coke, no mouth. Don't give the child. All our fruits, orange, watermelon, pawpaw, and all those things. Don't give the child.
So we have intensive care units, especially for the babies or very newborn babies of both mothers. So they have blood banks. They have all the gadgets you can use to look at neonatal issues, neonates, especially premature children. You have facilities that can deal with the theater facilities where you can carry out your operations with skilled staff. And where you need blood, blood is provided. And of course, they also provide antenatal care. Aside from that, that's a facility. We talked of human resource. And for that, apart from employing the right staff, we are also training people. We've also trained people on use of emergency obstetric care, especially at the primary care level. And some of these staff too have been trained to use the emergency neonatal care.
In all of this, one thing is clear, that is that most maternal deaths are avoidable, as the healthcare solutions to prevent or manage the complications are well known. Since complications are not protectable, all women need is care from skilled health professionals, especially at childbirth, when rapid treatment can make the difference between life and death.
Dr. Mrs. Bumi Ogundimo is a gynecologist that has seen it all as far as maternal mortality rate is concerned. She is the medical director of John Ken Hospital here in Lagos. According to her, governments, especially in developing countries, have a role to play in reducing maternal mortality rates, Nigeria inclusive. The issue of maternal mortality seems to be of great concern to healthcare providers, not just Africa, across the world. Why is it so?
Well, it's the mother that brings the child to the world, and the child is the future of any country. So in that direct relationship, it should be a grave concern for any country how well the mother is taken care of. As a matter of fact, the maternal mortality rate is used as an index of healthcare system, to measure how well a healthcare system is increasing. Any child that should survive the first year must be adequately breastfed for at least 6 months of birth, that which we call exclusive breastfeeding. What exclusive breastfeeding does is to build up the immune system of the child, so that child can be able to fight early childhood diseases successfully. So breastfeeding really has a role to play. Mothers must breastfeed for at least 6 months of the first 6 months of life without water or any other introduction of infant formula. But after 6 months, baby should still continue to breastfeed, and we say should still breastfeed till about the age of 2 years, just to ensure that child survives the very dangerous early part of childhood. So breastfeeding should be continued up to the age of 2 years, so that the child will grow well, good muscles, good teeth, strong bones, bright eyes, will have all the benefits of breastfeeding, and will start life. We call it the person has a good start off in life, and this will reduce infant mortality greatly.
Life is precious. Once you lose it, there's no replacement. The Lagos State government is taking the lead among all the states of the Federation at reducing maternal mortality rates. With the Mother and Child Center spread across the states, the government says it is committed to saving the lives of mother and child before, during, and after childbirth. Thank you for watching.